And by the way, he's also a member of my church. Yes, I love it, love it, love it, love it. Dr. Webley, it's so good to have you here with us. As a matter of fact, I hope you don't mind me saying this, but Dr. Webley is soon to be married. Yes, he is soon to be married. He is he is really excited about that, and I'm excited for him. And Dr. Webley, it's all yours. We love you. My friend, my brother, but most importantly, your friend, your brother, and Dr. Webley, he's going to present to us right now.
Thank you so much, Pastor, for that excellent introduction. I keep telling him he needs to be a part of my PR team. I appreciate you so much. This, for sure, is the best pastor I've had. He's a friend and a brother. He's our marriage counselor. We're getting married in 2 weeks, and he's our marriage counselor as well. So it's all in the family here. Larica and Sandra, thank you so much for the invitation. And so what I'm going to do is I'm going to share my slides, and we will go through some basic information about this virus. And I'm even go a little bit further back and talk a little bit about pandemics, because we've had them for as long as we can remember. We've had pandemics. And so this having a pandemic is nothing new. What is new is the aggressiveness and the transmissibility of this virus and what we see it doing and what we're learning about it. So hopefully, I'm sure you'll have questions, and that's what I'm here for, to try my best to answer. And whatever I don't have answers for, I will certainly find them and send them to you in haste, okay? So I'm gonna share my screen here. Hopefully you're seeing that. And so what I really want to talk with you about is kind of the impact of this COVID-19 disease, the virus that's causing it, what we know about it, and how we expect to proceed overall. So probably the pandemic that we're most knowledgeable about is the one that happened in 1918, the influenza pandemic of 1918 into 1919. And this was a terrible pandemic. This was an H1N1 influenza. And as you can see from the headlines, it's very clear that you're having similar types of issues here that we have today. Schools closing, churches closing, all of these things happening at the same time. And as a result of that, it caused a lot of disruption, caused a lot of problems overall for people at that time. And so, as I mentioned, pandemics have been with us. You can see there, if you can see the screen at the very top, the one that we know about is the Antonine plague. And it could have been smallpox, it could have been something else. But you can see there, it killed 5 million people in 165 to 180. You come down, the bubonic plague was a terrible one, killed over 200 million people. They called it the Black Death. And that was a bacteria. You had several outbreaks of the plague. At one point, we had outbreaks of cholera that caused significant issues as well. And then that brings you down to the Spanish flu that I talked about. And the Spanish flu was unique for several reasons. And one of the main reasons was the fact that at the time when the Spanish flu outbreak took place, you had the World War that was going on. World War I was actually just coming to an end. And it's called the Spanish flu, not because it affected Spain more than anybody else, but Spain was neutral. And while everybody else was fighting, they were there trying to be neutral. And so they actually reported the total number of cases that they had, while other people did not. And as a result, it seemed as if Spain had more cases. It's just not clear how many people died. That's why we have this wide range of 40 to 50 million people. But the lessons that we learned from the Spanish flu are still relevant, because when you look, what you're seeing is that you're seeing people there being taken up by the Red Cross. You're seeing people being put in ambulance there. And I just wanted to play a little audio for you so you can get a flavor of this.
One of the worst natural disasters in recorded history was caused by a virus. The influenza pandemic of 1918 struck every major U.S. city, dropping people where they stood.
There were at least 20 million people killed worldwide, and it's probably the worst pandemic the world has ever known. There were more people killed from influenza than there were from the First World War.
The war itself was the problem. If there had been no war, that year's strain would have stayed isolated. But when Allied troops met in northern France to exchange fire with the enemy, they also exchanged a lethal strain of flu. So it began.
It then went from France to the United States, and it disseminated from Boston.
At Fort Devens, Massachusetts, one case of flu turned into more than 6,000 cases between September 1st and September 18th. It took only 17 days. India lost nearly 4% of its population. Alaska, 8%. In the South Seas, the death rate was 20%.
People were absolutely panicked because somebody could be playing bridge one night and they would be dead the next day. And so they did all kinds of things. They were wearing face masks, and in fact, the police all wore face masks. They were carrying little pouches of garlic and onion, just anything that they thought would protect them from the flu.
They had no idea that they were leaving exposed the very place where flu enters the body, their noses.
Nothing was known about how to cope with it. And that is something that began to emerge when we got into the 1930s, 1940s, and 1950s. By that time, there was enough knowledge and experience and the development of techniques to make it possible to proceed.
And so the interesting thing about this period of time is what I'm showing on this graph. This was the first wave of that flu. Started in June, and by July, it had reached a peak. Then it started coming down, and what started happening was everybody started ditching their masks, people stopped social distancing, people stopped staying home. And I want you to see that the second wave came and it was 5 times as deadly as the first wave. And after that, people quickly went back in, they started doing the things that they were told. And even with that, they still had a third wave. And this is pretty common with contagious diseases. Now, this is from Johns Hopkins University, and it's the worldwide pandemic map. And as you can see on there, we have just under 12.5 million people so far have been infected with coronavirus at this point in time. Just under 600,000 have died, and 133,000 of those, approaching 134,000, is in the United States. And so we have learned some harsh lessons from this pandemic to date. When we look at the continent of Africa, with its 1.3 billion people, right now, the numbers suggest that you have just over 500,000 cases. The bad news is that the majority of those cases are in South Africa. And when you look at the western area of the Cape, going up to kind of the northeastern region, those regions are hit really, really hard. And we're going to talk about that. What this map is showing, it's actually showing what is called the vulnerability index. In other words, where do you find the most vulnerable people for this disease? In other words, by age, several epidemiological factors of transit, people who are living in some of the areas that Samantha was talking about, where there's drug use, people whose immune systems have been affected because they have HIV, that fragility, the strength of the healthcare system, how easy it is for people to get the care that they need, how readily can they get PPEs, personal protective equipment, and then population density. Population density is a huge issue where coronavirus transmission is concerned. You would have seen that watching places like Italy and the United States, in New York City and in Boston and other areas where you have huge population density areas. You have much greater transmission because there are more people to give it to. The people who are living far out on the countrysides are less likely to pick up this virus unless they come to town. And then, of course, socioeconomic factors. People who are living below the poverty level are always going to be more vulnerable. We see that in the United States, in the African-American population, and people who are living below the poverty level. And of course, access to transportation and housing. People who don't have good housing, who don't have good transportation, people who have to depend on public transportation are way more vulnerable than people who have private cars that they can travel around safely. So again, this index is important to look at as you look at which areas in and around the African continent are most vulnerable. So where did this virus come from? So all of the experts believe that this virus originated in a market in the city of Wuhan in China, starting somewhere in November of last year and popping up and being identified in December. So Wuhan is very populated, highly populated area. It's an area that is a hub for trade, for travel. And the other thing that it has is that it has a lot of what are called wet markets. In the early 1970s, when the poverty level in China was just so great that people were literally dying of hunger, the government there decided to allow people to be able to go and essentially collect bushmeats. And it was of everything from snakes to snails to wildcats, whatever. And initially people just collected these, caught them, and ate them for food at home. But then they widened this law and they allowed people to start selling them in these markets. And what you have there is that you have everything that is there. And people started encroaching on areas where you have snakes and bats and other things, and they would eat them and sell them. And just to give you an idea of how the close-up of these markets look, here you have a chicken, a live chicken, and it's sitting on top of this vegetable basket. Right in here, you have cutting areas, cutting boards. You have some frogs here, and over here is where he's cutting up the frogs. And you have, he's wearing gloves, but these gloves are really just to protect his hand and not to prevent cross-contamination. You have a scale up here that everything is being measured. This basin here is where they're putting it in so that they can weigh it, and kind of the waste area. In other words, everything touches everything, whether it's vegetables or whatever, it comes in. So if we do a little timeline, December 8th here is when the first cases started popping up in Wuhan, China. They didn't think it was anything. And then on the 26th of December, it was reported that this was unusual. The pneumonia that they were seeing in the lungs when they did the lung x-rays were just unusual. It was very diffuse. It was bilobal, lobar. It was multiple areas of the lungs. They started finding more and more cases. Then they found that it was linked to the seafood market by the 1st of January. And they started seeing active cases all over the city. By January, the WHO declares it a public health emergency, and it becomes a worldwide pandemic soon after that. So they've spread very quickly from China into Europe, and then from there to the rest of the world. So by the time the US had locked down, in other words, it was already in Europe. And then 11th of January 2020, the Chinese state media reported their first death of this virus. It's hard to believe that it's just been a little over 6 months that we've started having that. So we know that this virus is caused, that this disease is caused by a virus. What is a virus? And when you look at size, a virus is really tiny. Here's an atom down here, about 1 Armstrong down here. Then you can get to the place where you start having proteins, small molecules within cells, about a nanometer. You get right up here where you have a virus, about 10 to 100. Sometimes viruses can be up to 200 nanometers in diameter. But as you can see, viruses are way smaller than bacteria, and you can't see bacteria unless you look under a microscope. For viruses are really submicroscopic particles. They are the most abundant biological entity we have on our planet. They are found everywhere. They infect everything. They infect bacteria. They infect animal and plant cells. They infect amoeba. Anywhere you look, in seawater and fresh water, you will find viruses. And so this disease is called COVID-19, and I'm going to explain a little bit of the etymology to you. This is a cartoon that you typically see from the CDC. And this is actually what the real virus looks like. As I said, it's submicroscopic. So this is actually an electron microscope picture of this, a very high-powered microscope. What you're seeing here is that you're seeing kind of these spikes on the outer surface that are depicted here. And the corona, its name comes from the Latin for crown, because of these spike proteins, when you look on the microscope, they look like a crown. And so that's where the family coronavirus comes from. So it's a coronavirus, a member of the coronavirus family. The disease is called COVID-19, and it stands for coronavirus disease 19, or 2019. It's the year that it was found. And then the virus is called SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2, because this is not our first encounter with coronaviruses. We have seen them before. We have coronaviruses like this NL63, 229E, OC43, HKU1. These are endemic. These cause the common cold in any given season. We don't really worry much about them. We knew about SARS that came about in 2003. I'm going to talk about that in a little more. And then MERS. And these were the two viruses that cause illnesses and deaths prior to SARS-CoV-2. But just to give you an idea, although coronaviruses are some of the larger viruses, 100 million virus particles can fit on the head of a pin. And that's going to give you an idea of how small these are. And there are tons of coronaviruses, that being depicted here inside of a cell is the nucleus of the cell, and all of these are viruses. And there are over 200 different types, it's estimated, of them. This is a family tree of coronaviruses. And again, the ones I was just talking about here in red are the ones that cause the common cold. You can see them over here. They're cold viruses that are transmitted in the same way that regular cold is transmitted. Your SARS and SARS-CoV-2 fall in this branch of the tree. And I want you to notice that they're very closely related to a bat coronavirus. And this is important because all of these coronaviruses were transmitted from bats, sometimes to some other intermediate host, either a camel, or in the case of SARS, the 2003 one, a civet cat, and some other host that humans interact with before it gets over to us. So again, bats are a major reservoir. And the interesting thing about bats is they're mammals, and they're communal. They like to be together the way we love to be together as humans. They like to hang out together. But when you add to that the fact that they can fly, it means that they can transmit something from one place to the next in a very, very short time. And what happens in China and in some of these countries is that bats are not only eaten, people encroach on where these bats live. In other words, they live very, very close to where these bats are. And that is when we started seeing these newer coronavirus. So in 2002, this SARS outbreak was a very deadly outbreak. It killed 10% of the people that it infected, and it ran across 17 countries in a very, very short time. But when you think about it, at that time, we thought it was really bad, but it only infected 8,000 people. And then you have MERS, the Middle East respiratory virus. And at this point in time, the good news about this is that we haven't seen it beyond the Arabian Peninsula and in some parts of China. It hasn't traveled to other countries because its host, its intermediate host, is a camel. And we haven't seen human-to-human transmission at this point because it gets transmitted from the camel to humans. But it is pretty deadly, and almost 30% of people die from it. With SARS-CoV-2, or COVID-19 agent, it's way more transmissible than these two cousins that it has. But luckily, the mortality rate is way lower than these other viruses. So here you have the spike proteins of this virus in cartoon form. And this virus is a really large virus compared to other viruses, as I said. It actually makes about 29 proteins, but the important ones here in terms of when we're going to create a vaccine are these spike proteins that it has, because this is actually what it uses to attach to cells. And it actually binds very well to what we call the ACE2 receptors on these cells. And this little cartoon, what it's showing you is depicting a virus and just relative size. And this is actually the membrane of a cell that you're seeing down here, a fluidic kind of a membrane. And on the surface of this cell are these receptors, these ACE2 receptors. They're covered all over the cell. It turns out that if you have diabetes and you have high blood pressure, you have more of these receptors upregulated on the cells in your respiratory tract. The data has also shown that if you have asthma, you have a lower amount of these in the respiratory tract, which is counter to what we had thought. But now you see the virus, it has these proteins that are sticking out, and it comes and it binds to the surface of these cells. And that is actually how it is able to get in. Once it binds more tightly. And as I said, this virus has a very high affinity. In other words, it binds very tightly to these receptors on the surface of the cell. And once it binds, it is able to be pulled closer to the cell, where the membrane of the virus gets to touch the membrane of the cell, like you're going to see there in a minute. And then that now allows the RNA of the virus, the nucleic acid material of the virus, to flow into the cell. And because this is a positive strand RNA, for those of you with medical background, it's able to readily transcribe, and you now have a productive virus. And again, it's showing you. And so this is the spike protein that you're having. And then essentially what they showed recently is that these receptors, these ACE2 receptors like you're seeing here, are found on just about every organ system in the body, from the nasal passages to the lungs, the intestines, the heart, the eye, the liver, the bladder, kidneys, pancreas. And this is important. That's why diabetics are so affected, because the virus destroys the pancreas. The islet cells in the pancreas that make insulin actually have high levels of receptors for this virus. So in the brain, people talk about losing sense of taste and smell, having cognitive disorders, because the virus can actually affect these organs. It can affect the placenta, the testes. And so the multi-organ involvement that we've seen from this virus is because of the receptor that this virus binds to can be found just about everywhere. So this is just showing you that there is a window period where the viral load is pretty low. The amount of viruses in the system is low. And after a while, the viral load goes up. And at the same time, we start making an immune response, start making what we call IgM antibodies. And they're the first ones that will fight against the virus. But then they class switch to IgG antibodies. And when people start talking about vaccines and whether or not you're protected, antibodies are Y-shaped proteins that actually bind to these spike proteins and neutralize them, actually prevent them from attaching to the cells. And that's what a vaccine would essentially be able to do. And so one of the troubles with this virus, one of the big problems, is that we know that people can shed this virus for a long time. In fact, recent data shows that you could be shedding this virus for up to 30-something days. And the sicker you are, is the more viruses you'll have to shed up to that point in time. The problem is that the data shows that you can actually transmit this virus prior to showing any symptoms. And so a lot of asymptomatic transmission is happening. The good news is that 80% of people have pretty mild to moderate disease. And then even for people with disease that's getting more severe, only about 6% of them actually end up needing hospitalization. But when you're talking about tens of thousands of people getting infected, that becomes a problem. As I said, you can have this asymptomatic transmission, unlike the flu, where if somebody's coughing or sneezing, they know that they have it, they feel horrible, and they stay away because they're too weak to move around. For this virus, that hasn't been the case. And we know now that it's transmitted not just in large air droplets that come from your cough or your sneeze that falls to the ground quickly, but for smaller micro droplets that can sit around in the environment for a while. This animation, I'm just going to show you what happens when somebody actually cough or sneeze and how this virus can actually get spread. All right, let me get this off and play this.
About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the microdroplets, shown in red, continue to drift. This simulation uses only microdroplets. 5 minutes later, 10 minutes later, 20 minutes later, the microdroplets are still floating in place.
And therein lies the issue, that you can have these microdroplets just floating around in the air and having some amount of virus in them, and then that can be transmitted. One of the things we know is that it can be in aerosols up to 3 hours, but on places like plastic and stainless steel, it can sit on them for even longer periods of time. The question is how many were in there to begin with, and how readily can you transmit? Now, the idea of wearing masks then is because of these larger droplets and these micro droplets, that if you are wearing a mask, you're able to protect yourself from some of these large droplets. The smaller droplets might still be able to get through a regular mask, not an N95 respirator, like what you would expect that doctors and nurses would probably wear if they are getting good PPE. This is an N95, and it can protect you from 95% of all droplets, even small ones that are 0.2 microns in diameter. But for the regular surgical masks, the ones that people typically wear are the DIY ones that you make from cloth. They have variable amounts of protection. But what we do know is that they do protect from large droplets. And large droplets, of course, would contain more of the virus. So they do offer some protection. What you have to do, though, is that the nose needs to be covered. I see people wearing it and the mouth is not covered. Some guys are wearing it as if they're protecting their beard. That's not going to work. It needs to be over the nose and mouth. It needs to be covering those areas in order for it to actually be protected. So I'm going to show you a little bit of an animation here of using high-speed cameras, capturing somebody just breathing, because just your breathing will actually allow you to push this virus out into the environment. So here we go.
This is how COVID-19 is spread. Through air currents potentially carrying microscopic droplets full of coronavirus. When we talk, breathe, or cough. And at 250 frames per second, it shows us exactly why masks work to slow airborne infection.
Okay.
What we do know is whether you're using a bandana, an N95 mask, or a cloth mask you sewed at home, they all still have a lot of droplet blocking power. But that mask has to fit. This is almost like not wearing a mask at all. A mask that's too tight or has too many thick layers can actually force more air out the sides. With someone talking through a sheet of laser light, illuminating all of the micro droplets released as we speak. With a mask, those droplets are all caught. And this microbiologist.
That's why it's so important to wear the mask, because of these micro droplets. And now lots of scientists believe that the virus is airborne, as we've thought, because it's sitting around in the air for long enough that if you walked into an elevator, you could get it. Now, initially, we talked a lot about flattening the curve. And this is important in terms of healthcare capacity. In other words, how many ICU beds does your hospital or clinic have? How many of them are currently filled with patients? What is your surge capacity? The idea is, if you socially distance, if you stay home, if you're able to wear a mask and not cause a big outbreak, then your hospital can manage the virus. But flattening the curve doesn't mean that you've gotten rid of the virus. All it means is that you now have it at a place where it's manageable. And if you notice, when the curve flattens, sometimes it trails off for a very long time. And so you still have the virus to deal with. The idea is to have a manageable level of viruses. So if you get an infected person who tests positive, you can contact trace, see who that person has come in contact with, then go now and find who that person has come in contact with and quarantine them for 14 days. And if any one of those people turn up positive, then you go and you do the same thing and you trace back and forth. And what you want is, you want to be able to have a period where the number of people testing positive is pretty low. Now, I'm going to talk a little bit about some of the symptoms and complications of the virus. I told you already that the virus can attach and enter cells in basically almost all of our organ systems. But what it does to the lung has been surprising. Many times when you look at an X-ray of a lung infection, you see this area of damage. It typically is in a single lobe. It typically is just one area. That hasn't been the case with this virus. And that is one of the unique things. And so this is an animation coming from George Washington University Hospital. And it's a 3D model of what they're seeing with the pneumonia in the lungs. So here you're seeing these areas in green. These are the areas, and you can see it's in both lungs. Both of the lungs, these greenish, yellowish areas are areas that the virus has caused damage to. The interesting thing about this is that it was earlier in the infection, and they didn't get to take one when the patient actually had to be intubated. And so essentially what it is showing you is that this virus can cause extensive damage. It's an autopsy of a lung cross-section. You can see the massive infiltration down here for those of you who are used to looking at histology. But up here, you can just see the tremendous damage that it has caused to the lung, causing that infiltration and pneumonia right across the lung. And that is true only in severe cases. So in the milder cases, the virus can cause an infection and you can transmit it because it's in the mucus, it's in the airways. But in severe cases, what starts happening is the lung starts filling up with fluid. And as a result, your lung is supposed to exchange oxygen, like what it's doing up here in a healthy lung. That you inhale through the bronchioles, it comes down to the alveolar sacs down here, and then you have these small capillaries, these small blood vessels with red blood cells. The red blood cells have hemoglobin, which carries the oxygen that is being exchanged here. You have carbon dioxide coming from the blood going into the lung, so you can exhale that. You have oxygen coming in as a higher affinity because of the amount of it, and that now gets taken to the extremities so you can get the oxygen that you need. That's your typical system. However, in your severe cases, what happened is that this mucus fills the lung, and as a result of that, that exchange of oxygen can't take place. Hence the ventilator, right? So you use a ventilator so that you can actually now force the air into the lungs so that people who have this condition can actually have the air exchange that they need overall. So that's just an overview. Now, some of the conditions that make you more likely to have this disease: cardiovascular diseases, diabetes, other underlying respiratory diseases, hypertension. All of these things significantly increases the case fatality rate. In other words, people who have these conditions are more likely to die. I just want to show you a case that happened in China right around January of this year. So A1 here in yellow is a person who came from Wuhan, and traveled to a city about 280 miles away with their family members. So they are sitting at table A, and all the people at table A are family members. So a 2, 3, 4, 5. And they sat at this table over a period of time and they had a meal. And everybody who has a red circle around them is infected. And so that person was able to infect 4 other people at this table. But I want you to notice something. They infected people at table B and table C as well, but not table E and F. And initially they didn't realize what was happening, but there's an air conditioner right here that's blowing in this direction, right, towards this glass screen. And what apparently happened is that it forced this air over table A, brought it over table B, then bounced it off the wall, and it came back and came right over all of the tables. And that's how people at table C got infected. This is important because as people start opening up back restaurants and bars and other areas, it's really important, and churches, it's important to realize that your airflow and the length of time that people spend in these areas is going to have a significant impact. So people talk about a vaccine and everybody is waiting for a vaccine. And this is kind of just a vaccine reality check, that you can make a vaccine against just about everything, as Aaron said. But it needs to be effective and it needs to be safe. These are the 2 important things about a vaccine. Safety is the very first one, because vaccines are not given to sick people. You give vaccines to healthy people. So safety is paramount. But then the vaccine has to be effective. You know, can it actually prevent the virus from entering? Because those of us who work with vaccines know that sometimes you can make a vaccine that seem to block the virus, but then later on, for where safety is concerned, you realize that it actually allows viruses to come into the body much more than if you didn't have the vaccine. And so vaccines take a long time to make. The optimal time for making vaccines, even in these modern times, is 5 to 10 years. And so what we're trying to do now is that we're trying to make a vaccine in a relatively short period of time. And this is the most optimistic view for having a vaccine that could be tested. That maybe sometime in the spring of next year, we might have a vaccine if they have expedited trials. And essentially what they would have to do is that they would have to overlap, because vaccines have what we call phases. You know, phase 1 of a vaccine is that you give it to just a handful of people and you're looking to see if it's safe. And that's after you've done an animal trial to see if this preclinical trial is actually safe. And there you check out doses. You're not even trying to figure out effectiveness in a phase 1 trial. In a phase 2, you add more people, but you're still checking for safety. And this is the stage where you actually start checking for efficacy. Is it working, and how well is it working? What dose is it working well at? And that still just has a few hundred people. Well, then you have to get to phase 3. And phase 3 clinical trial has tens of thousands of people. And essentially what you're doing is that you're giving this vaccine in a double-blind manner, case control series. Essentially, you're giving some people a placebo and you're giving others a vaccine. It's totally randomized, so the doctor and the patient don't know who's getting what. You have an agency who's controlling that, and they are the ones who know who's getting what. And the idea is that you have to have this phase 3 at a time when you're having high levels of viral transmission. And what you hope is that everybody will not protect themselves. They will not wear a mask all the time, because you want to have exposure. If you don't have exposure, you don't know if that vaccine has worked. And so I'll stop there for now. And I'm happy to take your questions. Hopefully this generated some questions in your minds and you're willing to have a discussion on
this. Wow. Thank you so much. Sonia's got a question.
Yes. So some of our Facebook viewers has asked also some questions. And one question is with regard to ventilating. They would like you to clarify the issue on ventilating a positive patient, because some reports has stated that it's quite dangerous to start ventilating a positive patient. Can you shed some light on that?
Yeah, what the statistics has shown is that a significant proportion, in fact, the vast majority of people who are put on ventilators never make it off. They die. And initially, I think what was happening is that the doctors were being too quick to put patients on ventilators instead of trying everything else first. And so what I realize now is that if you use corticosteroids, glucocorticoids, and you lower the immune response, because what you're seeing here is not so much the virus that's causing the damage, it's the immune response to the virus. What happens initially is that when you get a viral infection, the innate immune response, the built-in immune response, the fact that you're human means that you have certain cells and certain chemicals like interferons that are released that will block a viral infection. That is not happening with this coronavirus. In fact, the research has shown that what it actually does is that it actually actively blocks that innate response. Then later on, as the virus starts infiltrating inside of the lungs, the adaptive immune response, where you make antibodies and cytokines and chemokines, catches on. But by the time it catches on, you have so many viruses and you already have this inflammation. And so it pours all these immune cells into the lungs to try and fight off this infection. It's almost like you're in your house and you're sleeping and you have an alarm system that's supposed to alert you that an intruder has come in. But somehow it cuts, the intruder has cut the cables. And so your alarm system, they overrode their alarm system, so it never went off. And then now you're in your house and you hear somebody walking up the stairs, you're startled. And so instead of really being thoughtful about how you're gonna approach the situation, you panic. And you start making noises and you start throwing things and you start screaming instead of hiding. And that's essentially what the adaptive immune system does. And that's now is the inflammation that causes all of this fluid influx. Now, what the corticosteroids, what the inhaled steroids do, is that it lowers that immune response. And it prevents that overactivity of the immune response. And if the doctors now, what they're telling us is that they're trying to hold off for as long as possible before putting a patient on a ventilator. Because, you know, essentially what you're trying to do when you put a patient on a ventilator is that you're trying to give the lungs a rest. The lungs are working so hard to try and get oxygen in, and they can't. So you're giving oxygen to the patient and you're trying to get the lung to heal. But because of the extensive damage that the virus causes, sometimes that healing doesn't happen, or it doesn't happen quickly. So, you know, over the time, a lot of the patients that we're putting on ventilators, 25, 30 days later, the patients were still on a ventilator. And then sometimes they would take them off and they would have to put them right back. So the idea is that you hold out for as long as possible and you use all the other measures. Remdesivir seemed to help a little bit in lowering the inflammation and cutting them out of viral load. And maybe in combination with a corticosteroid, inhaled steroid, it might help to lower the inflammation and give the patient some time to heal.
Thank you. So on the ventilation of a patient or in the ICU setup, even if they're not intubated and on the high oxygen and they're receiving physical therapy, for instance, it's reported that it dramatically the saturation, the oxygen saturation. And the question is that why is it that your oxygen saturation drops so quickly with movement, or even people don't even know that they have low saturation? So oxygen saturation has to do with ventilation and those things.
So you were breaking up a little bit, but I think what you're asking is about the quick drop in the oxygen saturation. And that probably is a combination of everything. It's the tremendous inflammation that the patient is having. It's probably also the destruction of your bronchioles, you know, the air sacs that you're having. They're laden with mucus and fluid. So the exchange is not happening the way it should. And so what the doctors have realized now is that if you turn the patient onto their stomach and then put like a CPAP machine on and give them 100% oxygen, then that delay them having to go on a ventilator. And so the ICU doctors have become very creative with being able to do that, with putting the patient on maximum amount of oxygen, and then from there, trying to taper off, giving the patient an opportunity to start breathing a little bit more on their own. And again, I've seen patients who were on ventilator and they got taken off, and 2 months later, they're home, but they still have to have oxygen that they're taking because their oxygen saturation is still lower than in the 90s. You know, you're having patients whose saturation is dropping from 90s to 60s percent in a very, very short time. And again, it's just the damage that is caused, the inflammation and the fluid, and probably other things that we haven't fully understood yet. Samantha,
Yeah. Yes, I have a question. I just wanted to know what some of the protective factors are with regards to actually contacting the virus from someone who is positive, because I've had personal experience, obviously, with being a medical professional. I obviously protect myself as much as I can at work. But my husband actually tested positive and I've remained negative. So I just wanted to know sort of what are the protective factors that keep you negative, or if you are in contact with someone who is positive, are there any factors that prevent you from getting the virus, even if it's a close personal contact that you have without PPE?
Yeah. So not every person who comes in contact with a positive person will get infected. But this virus has a very high affinity for this receptor, as I said. So it all depends on how much the person you're in contact with, how many viral particles per milliliter are they having in their nostrils. We know from studies that were done in Germany that even days after an infection, people still have 10 to the 7 viral particles per milliliter of saliva. So that's a lot of viral particles. However, if you're wearing a PPE and you're wearing it properly, you will protect yourself. So it's interesting that your husband got it and you didn't. I don't think it's a biological factor. I just think it was just exposure to somebody unwittingly who had it, and then he got it. And maybe after he started showing symptoms, you would socially distance. And so you actually didn't pick it up. But we haven't seen anything biologically apart from blood type. It seems like people with type A blood, for whatever reason, are more likely to get the virus than people with type O. So, you know, of course, vast majority of the population is type O, but it doesn't mean you can't get it, but you're 40%, close to 40% less likely than a type A person to get it. For A and AB, of course, these are rare. For B and AB, these are more rare blood types. So we really don't know what the numbers are on those. But that's the only thing I can see. But of course, as I said before, if you have underlying conditions, if you have diabetes and high blood pressure, if you have COPD, if you're hypertensive, all of these things seems to predispose you to having the virus, because it turns out that they actually increase the number of ACE2 receptors on the cells in your respiratory tract. However, what they've shown is that for people with asthma, they have a lower amount of ACE2, because that was one of my concerns in New York City. New York City has about a 10 to 14% asthma rate, asthma prevalence. And I thought to myself, oh my goodness, these asthmatics are going to be devastated by the coronavirus. It didn't happen. So we're all just really surprised about that. Then these studies, they quickly went and did these studies and was able to demonstrate that these asthmatics, by nature of their disease, have a significantly lower density of ACE2 receptors on the surface of their cells by nature of the disease. And as a result of that, they would be less likely to become infected. So we're still learning a lot about this virus.
So I just like to add, it's sort of a lead-on question to that. I know that the likelihood that children get infected with corona is also much lower. Do we know what the protective factors are specifically in kids and kids under the age of 5?
Yeah, very good question. They're also thinking that it's a lower level of the receptor, that they just don't have as many of the ACE2 receptors in their lungs. So the biology of it is what is driving the differences I think that we're seeing in infectivity. However, once you reach age 10 to 12, thereabouts, they seem to have more of these receptors, so they can become infected. However, they don't typically show symptoms. You know, they've seen this multi-organ system failure in some kids, but that's just been a handful of children who have had this kind of generalized inflammation, and they get really, really sick and have to be in the hospital. They're seeing more and more of this as more young people seem to be getting the virus, but it's quite random. It's your 60-year-olds and older that are most susceptible to significant symptoms from this virus.
Can I go? Is it? So I just want to go towards prevention. So we, as environmental health practitioners, we do a lot of education and awareness within the community. And obviously with more things opening up, so your salons and your restaurants, your takeaways, that's a big thing for us now, going back into the industry. And I'm so glad you spoke about the ventilation and the aircon and things. So the biggest thing for us now is everybody's asking us, what do they do? How do they go about, you know, the prevention of it in public places? And specifically now we spoke about kids, the schools, the institutions, even creches going about it. Could you just shed some light and possibly just speak about sanitizers as well? Because a lot of people want to go the herbal remedy and they don't want to use the, 70-80% alcohol. Just to share some light with regards to that, please.
Yeah, very good question. That's a discussion that everywhere in the world is having now about how do we safely reopen when this virus is still out there. Now, there is nothing more effective at preventing this viral transmission than hand washing and wearing a mask, right? Washing your hands, not with antibacterial soap, because the truth is, antibacterial soaps and antiviral soaps are just a myth. Microbiologists laugh when we see this, because the truth is, when you think about it, for those of you who are physicians and you prescribe an antibiotic, how long does it take to work? You give a patient a course of antibiotic at the shortest for 3 to 5 days, right? That's how long it takes for you to build up a certain amount in the system for it to actually kill. How long do you wash your hands for? And, even if you had a certain concentration of antibiotics in the soap, how much of it actually are you putting on? How much is it diluted once you get water on it? And how much of it just gets washed down the sink? So essentially what I tell people, get a soap that suds a lot. It almost annoyingly sudsy, right? With a lot of surfactant in there. What does that do? Number one, if it suds a lot, it means that it has more surfactants. So it removes the oils from your hand. Because these viruses, that's where they get stuck, in the oils that you have on your hands. And because it's so sudsy, it will take you a longer time to wash it off your hands, wash the suds off your hands. So it'll actually get you to that 20 seconds of washing, which is exactly what you need to wash between the fingers, wash the back of the hands, wash properly, and that will get rid of 99.9% of these viruses. And again, you don't have to kill them, you just have to get rid of them. People have been talking about eating garlic and inhaling steam and all of these things. None of those things prevent you from getting infected with this virus. None of them at all. So in other words, there's nothing out there right now that's going to prevent you from getting infected. In fact, even when you get a vaccine, the vaccine won't prevent you from getting infected, because that's not how vaccines work. What they do is that they prevent you from getting the disease, because when you get infected, your system has this built-in antibodies that have been produced in memory cells that neutralize the virus. But it has to get into your body first before it gets neutralized. Your antibodies are not sitting out on your skin and out on your nostril, preventing you from getting infected. And so people need to understand that. And so when you go out and you tell people that if you eat a vegetarian diet, then that's going to prevent COVID-19, or, if you're drinking these energy drinks and all of that, none of that is true. What the herbal stuff will do, and what your vegetarian diet will do, is that it will enhance your immune system. And hopefully that enhanced immune system will give you a better chance of fighting off this virus and lowering the symptoms that you'll have. And so again, I'm not saying don't go out and be healthy. The more healthy you are, is the better you are to overcome this virus from all the data that we've seen. But again, nothing that you do except for these hand washing, mask wearing, social distancing, being constantly vigilant, telling yourself that every single person who you meet is coronavirus positive, right? And that's the way, for those of you who work in healthcare, you know that's the way we think about infectious diseases, especially when HIV came around. If you were a phlebotomist, or you were a nurse, or you were a physician working with a patient, and you didn't test them for HIV, you'd use universal precaution. Universal precaution says that you assume that everybody has the worst infectious agent that you can think of. In that way, you protect yourself because you don't know what you don't know.
Thank you, Prof. Can I just ask something just with regards to the ventilation? Because a lot of the places have mechanical ventilation. And so there isn't a lot of natural ventilation within, like in your restaurants, if you're in a smoking area, whatever it might be. So what would you recommend with regards to ventilation?
I would recommend exhaust fans.
Okay.
I would recommend having a new filtration system with a HEPA filter installed, making sure that all of if you have air conditioners, that the filters have been changed and cleaned so that you can trap these viruses and prevent them from circulating. But I would want that air inside of that space being exchanged on a regular basis. In fact, I would be happy if that air was exchanged twice every half an hour. In other words, pulling out the air that's in there and putting in fresh air. And so you can get that from having from a retrofit of having a good exhaust fan that pulls the air in the room outside, and then now having new air from outside getting in. So that will dilute, even if you have somebody in there who is infected, it would dilute the number of viral particles you would have in there at any given point and significantly lower the chances of getting infected. For children going back to school, I would suggest that as much as possible, they still maintain social distancing. They sit 6 feet apart, that instead of using regular classrooms, if the weather is good and you can have class outside, it's better. If you can use your auditoriums and gyms as classroom space instead of the smaller classroom spaces, that's also better. And that's what everybody is doing now. For our schools, that's what we're looking at. We're looking at places that have the space, the square footage, and those spaces are being measured, and it's determined what the capacity is. An engineer is coming and measuring that space and looking at the usable space, saying how many people can we have in this space safely, socially distanced. And for children, especially for young children, there has to be times when they're not wearing their masks. They need no mask times, and if you can get them more than 6 feet apart, then you can actually have them not wearing their mask, especially if it's outside, so they can get a break from it. The mask is not going to cause them any issues, but it's uncomfortable. And so you want to give them the opportunity to have that comfort level doing. And what it means then is that every school system will also need to plan for a contingency. You have to plan to not have school in person, have a hybrid system where you have some sort of platform, whether it be Moodle or Blackboard or some other learning platform where people can learn from a distance, because even if everything is going well, it just takes a small mistake to cause an outbreak and you'd have to totally close a space that had already available.
Meredith, your question?
Yeah. Hi, Prof. I would like to know on pregnancy. As we know, above 28 weeks, the vulnerability of contracting the disease is very high. And we see now with your presentation that the placenta also holds the receptor cells as the other organs. So I would like to know what the effect on the unborn fetus might be, and how what we could advise the pregnant mothers to do to just prevent or contain the
Yeah.
virus.
At this stage, that's one of the big unknowns. You know, are there teratogenic effects of COVID-19? The fact that it is there and there are receptors in the placenta, can it cross the placenta and go into the fetus? And there have been conflicting studies out on this, but I think it's because the numbers have been small. And so at this stage, what the recommendation is that as a pregnant woman, you keep yourself socially distanced as much as possible. You avoid any contact with people, especially those who are going out and getting into crowds, so that you can actually prevent yourself from becoming infected. Because at the very least, let's say it has no direct impact on the fetus, but if you're in respiratory distress, then your fetus is in respiratory distress, because your oxygen is what the fetus is feeding on, right? And so any sort of toxic chemicals that are released, cytokines, one of the things, again, this inflammation I'm talking about, we call it a cytokine storm. You know, cytokines are these chemical messengers that cells use to talk to each other, but your serum, your blood is filled with them. And those now can cross the placenta. And what sort of impact could those have on an unborn child? And again, it all depends on what trimester you're in, probably. But I would say that for any pregnancy right now, the primary objective is to protect yourself from being infected. And if you feel like you are, you certainly need to, in addition to going to the doctor, you certainly want to contact your OBGYN to do regular checks on that fetus.
Okay, since I'm a nurse and currently also pregnant, I would like to know, we have staff coming back after 14 days of quarantine. On the 15th day, when they return to work, we are still in contact with them. So I would like to know the transmission, is it still possible, or is it totally void?
Yeah, that has been one of the things that people have gone back and forth on. But as I mentioned in my presentation, the data doesn't support this minimum 14-day time, because what they've shown is that 30-something days later, 38 days later, people who were positive, especially those who had significant symptoms, still had viruses. And not just testing positive by PCR for the nucleic acid, but physically had viruses that could be cultured from these individuals. So the rule should be, and the WHO recommendation is, that you are not really positive, you're not really negative unless you've tested negative twice after that 14-day period has passed. Here's the other complication of that. There now seems to be credible evidence that there are people who are getting reinfected after having had coronavirus and recovered from it. And initially we thought that this was just a fluke, but it seems when we look at the antibodies, we talked about the neutralizing antibodies that we make against the virus. It turns out that a third of people who are infected don't make high amounts of these neutralizing antibodies. And if you're not making the neutralizing antibodies, it means that you're not preventing infection. So you could have a person who got infected, in my opinion, and if they didn't make copious amounts of these neutralizing antibodies, and if these antibody levels drop, those individuals could again become positive and possibly transmit it. So especially in the clinical environment as a nurse, my suggestion would be that if they can provide a test to show that you're now COVID negative, in my opinion, those nurses should not be back working with colleagues and patients, because you could possibly transmit to somebody. And also possibly to your household if you're not isolating.
Just to follow up on that, South Africa has some changes coming up in terms of that time frame, and it's quite concerning. They're cutting it down to
8 days.
8 days if you've been infected,
Yes.
and
Yes.
5 days if you've had 3 days, or 5 days if you had exposure. So yeah, we are at a bit thin ice, because I think what's happening is people are apparently getting sick or saying that they're sick and they need to isolate for 2 weeks, and they've been doing that recurrently over a period of time. And I think they're not attending to work as much. And so government's pulling in a bit, and the epidemiologists are speaking towards those 5-day, 8-day time frames to shorten our 14-day that we already have. And also, you start counting the 14 days when your symptoms start and not after your test. And that's also been causing confusion in South Africa. So if you could maybe speak more on that.
The data doesn't support an 8-day or a 5-day quarantine. The 14-day quarantine came from what we saw over a 2 to 3 month period of people and when their symptoms went away. So I can't imagine what the rationale would be for a 5-day or an 8-day quarantine, because we know that you're actively shedding viruses at that time. Here's the thing. When in the initial stages of the infection, the saliva is a good, and the nasal swab is a good sample for testing for the virus. However, after that, once the virus starts infiltrating the entire body, you might test negative for it in a nasal swab, but still be very much positive. And where do you see it? I have some good friends who work with this virus who say that what should actually happen is that you should do an anal swab, because you're passing it in the feces a lot. And that's another thing, that the fecal matter is a huge transmission route for this virus. So again, the hand washing, the constant hand washing is a big deal to prevent this virus. Remember, I showed you that the intestines have high levels of ACE2 receptors of this virus. And that's why, you know, one of the regular symptoms for a lot of people who have the virus is diarrhea, right? That's the reason. You're having a lot of viral shedding in the intestines. So even after the lungs might look like nothing wrong, you could potentially still have viral shedding that can be transmitted.
So when you're viral shedding, you are still contagious.
For the most part, yes.
And what is viral dose all about?
The viral dose is the total, it's the viral load. It's a total number of viruses that you actually have in whatever sample we're talking about, in the saliva, in the blood, and wherever the virus is circulating. The higher the viral load, the more likely it is that you're going to transmit it to somebody. Because if you have a high viral load and you cough, the amount of viruses that you're going to have per droplet is increased over if you have a lower viral load.
I think this is probably the last question. Gargling with salt water, gargling with garlic water, any mouthwash that is there, will this eliminate the virus from the oral cavity or from the throat? How?
It might reduce the amount of viral load currently in the oral cavity. But remember, the oral cavity is constantly being seeded with the virus, right? So it's like you have a pipe that's leaking, and what you do is that you in your bathroom and you dry up the water on the ground. What does that do? You know, I could walk in a minute later and say, oh, the bathroom is dry, but then 5 minutes later, it's wet again because you really haven't corrected the problem. That's the issue with this virus. So whatever you're going to do is just cosmetic at that stage. If you do an oral rinse at that period, at that very moment, you would have washed out all the current saliva that you have. In other words, the concentrating of the virus in that saliva might be gone, but just wait a few more minutes to maybe an hour, and it's right back where it is. So the salt water, the gargling of the salt water or any other agent are not necessarily going to kill the virus, because where does the virus live? The virus lives inside of our cells, right? And so because the virus is living inside of our cells, in order for you to kill the virus, you have to kill the cells. get something that is able to get into the cell to kill the virus, to spare the cell. And most antivirals, that's what they do. They're able to get inside of the cell. But your body, the way your body deals with a virus-infected cell is that it kills the virus-infected cell, right? Your cytotoxic T cells and natural killer cells, that's their job. They're able to wipe viruses out because they kill the cell that the virus is infected. The virus is parasite-like. It cannot replicate on its own. It needs our cells in order to do that, right? And so if you get rid of the cells, you get rid of the virus, but we need the cells because they're carrying out regular functions in our bodies. And as you can see, the multi-organ involvement, it shows you how much we need these cells, so we can't just get rid of them. And so we just have to give the immune system time to be able to lower the viral load, to catch up with it, to have enough antibodies, and possibly some white blood cells that are helping us to manage the viruses. Because whatever you're taking is not going to clear your body of the virus. It's your immune system that does that. All that you need is to give your immune system a fighting chance, to lower the viral load enough so that your immune system can catch up so it can do its job of eliminating the virus. Because we only get disease. We're so fearfully and wonderfully made that we only get disease when the immune system becomes overwhelmed. That's what disease really is. Because otherwise, the immune system has so many redundancies. It has so many things in place to take care of any given infection that we have, that the only time we become sick is when it gets overwhelmed. And once you lower that load, that's what antibiotics do. They lower their load of bacteria in the system so that your immune system can catch up. And once it does, it clears everything on its own.
How do we increase our immune system again?
There were some questions in our chat. We answered those?
No, we still get there. How do we increase our immune system?
Through exercise, eating a balanced meal, having your full intake of enough water per day, depending on your body mass. If we're overweight or obese or have hypertension or diabetes, any one of those things are going to put you at risk. And it means that you have to go outside and get some vitamin D. If you're not able to get all the vitamins and minerals and protein, then you have to take supplements in order to get those overall. But essentially, following a strict health guideline is the best way to actually have a fighting chance against any infection, but more so in a pandemic.
Okay, we can go to the questions that was on the Facebook page that is posted in our chat here. Regarding the use of herbal remedies, like that used in Madagascar, the woodworm, how effective is it in helping patients to recover?
I have seen no data on that, and I'm a scientist, so for me, I'm data-driven. So people might find that they use something and anecdotally, they think it works, but how do you know that that's what worked? How do you know if you don't have a case control where you have some patients who got it and some who didn't get it, and you compare, how do you really know what worked? And so we have to be very careful about what we are saying work. And especially as Christians, many times we like to tell people that, oh, this thing worked, and God revealed this thing to me that worked. We have to be careful because we could be putting our own lives and the lives of other people at risk. At this stage, and I'll reiterate, at this stage, there is absolutely nothing that I have seen that is out there that prevents you from getting infected with this virus. So the important thing then is to be as healthy as you can possibly be, so that if you encounter the virus, you do have a fighting chance. There have been tons of vegetarians who have died from this virus. No kidding. In our own conference, in Northeastern Conference, we had something like 68, nearly 70 members died, some of them elders of our churches. In our own congregation, we lost a member who died from the coronavirus. We had several other members who got infected. A number of these individuals had a strict vegetarian diet. People say that garlic has antibacterial and antiviral properties, and that will protect you from getting infected. No, it won't. But does garlic has good properties? Absolutely it does. Should you probably put some garlic in your diet? Absolutely. But at the same time, it's important to note that is not going to prevent you from getting infected. So as long as you know why you're taking it, and you're not, so whether it's wormwood or it's bitterwood or it's some tea that your grandmother tells you that you should drink, by all means, drink all of those things, but wear your mask, wash your hands, and social distance.
The other question is by Rosemary. She wants to know, both my kids have type 1 diabetes. My daughter has a blood type aged 15 and my son a O blood type aged 17. Would you recommend them going to school?
Yes, if they are guaranteed to be social distance. And, you know, depending on their age, can they wear a mask for most of the time they're there? And, you know, if something happens, are you comfortable that the school has the type of protection and that they're vigilant enough to maintain that? And that would be my recommendation for just about anybody of school age, because again, the kid's gonna need school, and for parents, you need your sanity. So how long can you actually stay home with those kids? You know, there are kids, but we know them. We know that they're gonna push your patience, and if you have to work, who's gonna take care of your kids? And so we have to, at some point, we have to find a safe way to return. And the safe way to return is actually to have that social distancing, to have good hand hygiene, to wear a mask when possible, and when you're indoors especially, and to have as many classes outdoors as you possibly can.
Samantha?
Yes.
Do you have any questions before you go?
No, I don't. I just wanted to say thank you so much for this and being a part of this as well. I think it's shed a lot of light. I made a lot of notes because I often find that patients have a lot of questions and we don't always have the answers. So I was very, very encouraged by this, but also I was given a lot of information that I can definitely share with my colleagues and also the patients that I deal with on a day-to-day basis. So thank you so much to everyone.
Thank you very much for joining us.
Thank you.
Please.
Bye.
Bye.
You too. Bye-bye.
Prof, we've got one last question regarding the remdesivir.
Yes.
It will be released in South Africa probably soon. How effective is this for treatment of COVID?
Yeah, good question. It is not by any means a high level protection. In other words, the patients who are getting this are not patients who are at home. These are patients who are sick enough to end up in the hospital, and that's why I was prescribed. So at this stage, it is really being given to patients who are really, really sick. The question is, would it work even better if it was given to patients who weren't as sick? Would it be able to protect them? And I see where Gilead, they're actually going ahead and creating a mist form of it that you can actually put in an inhaler so that you can introduce it directly into the lungs before it was just in pill form. I'm not sure if that will give better protection, but it seems as though what it does is that it reduces the total number of days that somebody spends in the hospital. And it reduced that by about 3 days. You might look and say, well, 3 days, that's not a big deal. But when you think about it, every extra day that you spend in a hospital, there's a probability that you're going to go on a ventilator. If you go on a ventilator, the probability that you're going to get off a ventilator and walk out of the hospital is significantly reduced. So if this can reduce your risk of getting on a ventilator, then I think it's a good thing.
Okay, we've enjoyed this so much. We can speak to you all day, Prof. Webley. Thank you so much for sharing so much information so far, and we're so grateful. We can probably move towards the closing remarks, and then whatever questions we do have that we didn't answer today, would we be able to forward that to you?
Sure.
So you can go ahead with your closing remarks.
So there's no doubt that this is a tremendous burden on us individually as a population. This pandemic is no joke. There are people out there who think all of this is a hoax. There are people out there who says that this is not a virus, it's coming from 5G and all of these other conspiracy theories. My advice to those individuals is be prepared. Follow the guidelines that you're getting from your local health groups. Social distance, wash your hands. This is nothing to fool around with. This virus will kill you if you're in a vulnerable state, or at the very least, it will put you at a place where you have trouble bouncing back, no matter how healthy you are. We've seen it repeatedly. But as Christians, I also want to say that in our minds, in our hearts, we should be prepared for some of these things. That the Bible says in Isaiah chapter 41 and verse 10, do not fear, for I am with you. Do not be afraid or dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my righteous right hand. It is the same God who says in Exodus chapter 15 and verse 2 that the Lord is my strength and my song, and he has given me victory, right? And the same God who gave victory to the Israelites. And the Israelite says, this is my God and I will praise him because he's my father's God as well. That same God will take care of you. We have to remember that it is the Lord that goes before you. He will be with you. He will not fail you. He will not forsake you. So do not be dismayed. That remember that the eternal God is our refuge. He is our refuge. He's our hiding place. And underneath are the everlasting arms. So lift up your head and lift up your eyes to the hills, because that's where your help comes from. Our help comes from the Lord who made heaven and earth. The same Lord who made every organ, every cell in our bodies, and knows implicitly what is needed for us to survive. He promises that he will never leave us and he will never forsake us. So trust in the Lord with all your heart. He will indeed make these crooked paths straight. So I invite you to cast all of your cares, all of your anxieties on him. Why? Because he cares for us. We know that because we see it, not just because Peter affirmed it. Be strong, be courageous, do not be frightened, for the Lord is going to be with us wherever we go. Because God says that my grace, in 2 Corinthians 12:9, he says, my grace is sufficient for you, for my power is made perfect in your weakness. That is what I want to leave with you. Wear your mask, wash your hands, social distance, and trust in your God. You're muted.
Okay, thank you so much once again for sharing all this information and for availing yourself and years of knowledge and hard work that you've put into this and sharing it to us on this platform. We're truly grateful.
Yeah, I'm sure we just scratched the tip of the iceberg. There's still more to come, still more to find out. So yeah, everybody stay tuned and we'll keep you posted.
We have a testimony coming up by one of our people on the panel, Pastor James. Is going to share something, but I think he's busy on another call right now. Asking Meredith and Kelly, is there any other questions that they wanted to ask before we give it over to Pastor James? There was one more question in the chat room that was asking, I have a 20-month-old baby whose ECD is
early childhood development.
Is a reopening. What are the risks?
Yeah, I think we're all grappling with that. I mean, the risk is that they could pick up something and bring it home to you. You know, for kids, I think what they need to do for a 20-month-old, what they would want to do is to have toys in a box that only that kid plays with for a week. You throw them into maybe a 2% bleach at the end of the day, let them sit there for a period of time, and then wash them off so that they can play with them the next day. So you sanitize them. The other idea might be that you immediately create cohorts, little pods of kids, maybe 4 of them, who are in a group that they can play together. And you keep that group. You don't allow them to mingle with other kids, but you keep that group. And if you can get them tested, you know, it would be really good. But I know that in a lot of places, testing is not easy. But I think if you could get them tested and find out if these kids are negative, and if they are, then you put them in these little cohorts. So number one, because they're kids, they're going to want to play. They're going to want to play with other kids. And if you can get 4 kids in these spaces, and you socially distance the rest so that they're not intermingling between these little pods of them, and you have to become unconventional. If it's a daycare, if it's an early childhood place, instead of trying to keep them inside, get them outside. If they're outside, you can socially distance them. They can run around, and when they're ready for nap time, you take them back inside. You have their own little areas for them. But again, what you don't want is a kind of a classroom situation where they're sitting at desks, because they're going to become completely restless. You want to have wide open spaces. Take out the chairs, take out the tables if necessary. Put down mats on the floor and have these little areas for them that you've created. And you're certainly going to need helpers. And whoever it is that's doing this, whoever the teachers and other people are, they're going to have to wear PPEs. They're going to have to wear gowns and masks and maybe even face shields, because they might be vulnerable. So that you can be, these kids, they're going to need help. They're going to need help wiping their nose. What if they have a cold or the flu or something? You're going to have to make sure that as a parent, if they have a fever, you keep them home. They're going to have to be policies in place that is done. But it can be done. We can very smartly and in a slow way. At the time when you're having drop off, don't have everybody drop off at the same time, so you don't have a crowd. Have hand sanitizers, have thermometers that you can check their temperature, and be vigilant about this. Have additional helpers so that the people who are in there can get a break, so that they can take off their masks and sit outside and get a break from it. So we can't go back to things as usual until you get an efficacious vaccine and you achieve herd immunity, where you have enough people in the community who have been vaccinated or protected through infection, where it prevents the easy transmission of the virus from one person to the next.
Here's one more question about the BCG vaccines. There have studies shown that it is less, or studies that say that you're less prone to infections, as well as you recover quickly. What is your views on that?
It's an interesting thing that they're continuing to study, right? Because we've seen in places where the BCG vaccine is given, we've seen very, very low rates of infections. It's just not clear why. I mean, the of Calmette Gorin, which is what the BCG is. It's a weakened form of the TB virus that is given as a vaccine against TB. As you probably know, that vaccine is not given here in the United States and in some other developed countries because the efficacy is not very high. But parts of the Caribbean, in most of the African continent, in parts of Asia, we do have that vaccine. Is it doing something? We don't know. There's no receptor that seems to be shared. Could it be that there is a subset of T cells that was induced by this vaccine that now is actively working against the coronavirus? We don't know that. And so they're in the process right now. In fact, there are about 3 or 4 studies that are evaluating this right now, and hopefully they come up with some results soon to see if that is actually the case. But it's a really interesting phenomenon.
You mentioned bleach to kill the virus. What do we do to clean our house? What do we do to clean ourselves? How do we make sure surfaces, how important are those things?
Yeah. A 10% bleach made up fresh every day is a really good solution. If you can get it, a 70% alcohol, 70% ethanol also does a good job. In fact, when the pandemic just started, what I did is that I got 70% ethanol in a spray bottle that I gave to my fiance. So whenever she was leaving and she was entering her house, she sprayed the bottom of her shoes. You know, you spray your hands, that can kill the virus. It's readily kills the virus because the virus has an envelope. And that envelope is dissolved by your 70% alcohol, ethanol. You just have to make sure that you store it somewhere where it's not getting direct sunlight, otherwise it evaporates because it's high levels of alcohol, and keep it away from flames.
How quickly does that kill the virus?
Within minutes, maybe 5 to 13 minutes.
So you have to leave that area with the alcohol on.
That's right, and so that's true also with the bleach. You don't want to just wipe and leave. What the best thing to do is to spray and let it sit, right? That's how we kill viruses and bacteria with any one of these things, with any disinfectant. You want to spray it on the surface and leave it there.
And with air, if you're in a room, spraying the ethanol or the alcohol in the air, would that minimize the virus?
Not really. Because it's not made for the environment. Moreover, you don't want to inhale that either. You don't want to inhale too much alcohol.
So the foggers, what is your opinion on the foggers?
The foggers work because they actually have ionic particles in them that actually directly attach to the virus and kills it. So it's the solution that they put in the foggers. So those actually work because of the ions that they have. But it has an atomizer in there that you use to actually get that into the air, and it can actually attach to the particles of the virus.
Is there a specific solution that is in those foggers that you know of that are effective?
Different people put different solutions in them, but yes, there are specific solutions that are in them, and sometimes they do have some amount of alcohol just so that it can get sprayed, but they have antiviral stuff in them, as well as these atomizers that cause an ionic particle to be created. And that negative ion actually works well.
There's a question in the chat room.
So they say about blood clots being preferential, or that can be seen in COVID patients. Can natural remedies like cayenne pepper help with thinning of the blood, help to reduce or manage symptoms?
Yeah, this is a really, really good question. And this was very puzzling as to why some of these patients were dying in the way they were. And I've had ER doctors tell me that they have patients who come in who are on heparin or Coumadin, and they're still clotting. Even on those blood thinners, they're still clotting. And clotting so much. And the way they figured it out, where they first saw it, is that some of these patients, because the kidney involvement is so great, they put the patient on dialysis, and it clogged the dialysis machine because of the amount of clots that these patients were having, microclots all over. And this seems to be one of the things that lead to mortality in patients. So it turns out that the virus also affects the liver, where you have most of the clotting factors and proteins made, and seems to be causing the production of some anti-clotting, some clotting factors that are not being balanced in the system. And as a result of that, it seems to be causing that sort of problem. But I think they're still chasing down the full mechanism of why these blood clots are so plentiful in patients who have COVID-19. It certainly is a huge issue to overcome.
Absolutely.
And for most of these patients who start having this clotting, they especially if they're in the hospital, they actually end up dying because there's very little you can do at that stage. And I mean, the thing is that with giving people anti-clotting medications, you don't want to give too much ever, because if the patient gets a cut or a scratch, you can't take them into surgery because they're gonna bleed out under those circumstances. In fact, you probably don't even want to intubate if you don't have to, because you don't want to create any sort of abrasion or situation where the patient starts bleeding. So it's a very tricky position for patients to be in.
So what would you say in someone having listened to this talk, feeling absolutely overwhelmed and very afraid, and they've just gotten the news that they've tested positive for COVID?
I would say get as much rest as you can, stay hydrated. If the doctors have given you any sort of medication, make sure you take it. Make sure that you isolate yourself so you're not in contact with other people. And you might not feel like it, you might have lost your appetite, but just try and get some nutrients into your system, right? If you're in the hospital, then it's a different situation. The doctors will have to determine what is the best course. But for the vast majority of people, I showed you that for 80% of people who get COVID-19, it's a mild to moderate disease that does not land you in the hospital. But having a solid nutrition base is going to be really, really important.
The last question that we have, well, there's two. The one is asking about the story about the virus being airborne, and the other question is about, they've read about the use of glutathione, 200 milligrams. It helps with a cytokine storm.
Yeah. So again, the studies are starting to show that for people who go on any sort of corticosteroid treatment, it actually lowers your cytokine storm. I don't know anything about cayenne pepper doing any of that because I'm not sure what ingredient it has that would do that. People have found that some of these things, people said that some of these things work. But as I said before, how do you know? If you're not doing a case control study, how do you know that it just wouldn't have gone away on its own? And how do you know that if it works for patient A, it would also work for patient B? How do you know that there are no contraindications for using this and that it might cause other issues? So again, I am always resistant to recommend anything that hasn't been fully tested because it could be dangerous. So, you know, if somebody sees something that's working, maybe you want to mention it to somebody at your local hospital or doctors who are working with COVID patients, because maybe they have the knowledge and the information that can say, you know, I know about cayenne, I know it has this ingredient, this active ingredient in there. And if you use it in this situation in combination with this medication, I know that that's contraindicated. And so you don't want to do that versus, you know, just saying, oh, you know, this worked for my grandmother. Everybody should use it. You know, I think those are always dangerous things to do because you just never know. And unfortunately, with these types of things, you don't know until you know. And sometimes you know is the patient meeting their demise when they didn't have it. So again, nutrition is good, but just be cautious. And if it sounds too good to be true, that it cures coronavirus, it's too good to be true. This virus is formidable. It is by far one of the most contagious viruses I have ever seen as a microbiologist. It is so very contagious. The good news is that the mortality of it is probably at about 1% or less. And that is great news. In other words, the vast majority of people who get it don't die from it. But it doesn't mean that you don't have people who go to the hospital and have really serious issues. Probably up to 20-25% of people who get infected have what could be long-term issues from this. There are people who take months before they get back to their regular lung capacity. There are people who their taste hasn't returned, their smell hasn't returned. There are people who continue to have digestive issues and kidney issues. There are people who have gotten this infection who their intestine had to be removed, right? And so now they have to walk around with a bag. So again, you know, when people say, well, only 1% of people who get infected have some of these things. We have to be thoughtful that some of the people who stay alive, you know, just like what you see with cancer, there are people who survive cancer, but their lifestyle is dramatically altered by the pathology and the symptomology that comes along with this virus.
Thank you so much, Prof. Wilmore Webley, for being so patient with us. I don't see Pastor Jenks being back. Sorry?
I'm happy to continue answering questions until Pastor is ready.
Oh, okay.
Okay, cool. Let's go.
We still have about 70 something people watching online after 2 hours, so let's go. We've had 100 and something, so there's definitely some questions.
Yes.
One of the things that people often ask about is vaccines and how they're made and how they're developed, and you know, are we going to have one? And you know, how will that work? I'm happy to go into that if that's of interest to you as well. So, as I mentioned before, what a vaccine really is that it is you taking something and priming the body so that it can be ready to fight the infection if it ever encounters it. And so what typically happens is that you either use the whole organism, in other words, the whole virus. In this case, you would have to make it attenuated, make it not as dangerous, so it can cause disease. That doesn't seem to be one of the factors that people are using. The other one is to take a part of the virus, a part of the viral particle, maybe a part of one of the proteins, maybe the spike protein, make a lot of that and inject it into the person, and so that they can make a response to it. What seems to be getting traction is using the messenger RNA, the nucleic acid of the virus, the component that make the spike protein, and you're putting that in. It's called an mRNA vaccine. And what happens is that your cells pick that up and they express the protein and release that protein from the virus. In other words, you have your human cells that have taken up the genetic material to make a viral protein. They make that viral protein and release that viral protein into the circulation. Your immune cells encounter that, and specifically your B cells make antibodies, these Y-shaped proteins that bind to it, and it's like a lock and key, where you have a specific lock and only a certain key will fit. And so you have that specific key, but once the key is in the lock, no other key can come in. And with these antibodies, would almost like, not only are you pushing that key into its specific lock, but you're breaking off the key into the lock. And so now nobody else can open that door. In other words, the virus cannot enter the cell. So it's a neutralization. So the receptor, the ACE2 receptor that the virus would bind to, is no longer available because the site that the virus was using to bind to it has been blocked by these antibodies. And that's how the vaccine would work. And so you want to make these neutralizing type of antibodies because the entire viral surface can induce antibody production. In other words, if you have any microbe that enters the body, you have multiple different types of antibodies that are made against it, but only certain types are neutralizing. In other words, only certain types are very effective in preventing viral entry. And so that's what they're looking to make. There are over 140 different vaccine projects in works right now. Maybe about 8 or so of them are in phase 2, hybridizing phase 3 clinical trial. In other words, they're not just finishing a phase and then going to the next. They're actually overlapping these phases that I talked about earlier. And that's how they're accelerating the vaccine. Typically what would happen is that you would see efficacy in phase 1 and 2 before you go to phase 3. And you would wait for phase 3 to show you that it actually works before you start manufacturing. Well, what the US government has done is that it's given billions of dollars to vaccine manufacturers for them to produce these vaccines prior to a phase 3 clinical trial or in conjunction with a phase 3 clinical trial, which means that if the trial actually works, you will have vaccines ready right then to give to the population. If it doesn't work, you would have to spend billions of dollars on something that you have to throw away, right? So they're overlapping phases. Clearly, in a regular vaccine production pipeline, you can't do that because who has unlimited amounts of money? The federal government does. And so if they're bankrolling it, you can actually do that. But however, you still have to do your due diligence. You still have to make sure that it's safe. You still have to make sure that it works well, which means that there's no getting around a phase 2 and a phase 3 clinical trial. You have to do those. You have to look for that efficacy. You have to look for safety. And you want as broad a population as possible. You want as many people as possible from different cohorts in the population, older people, younger people, people from different ethnic groups, people with certain underlying conditions. You want all of them into a trial like that because you want to see what are the side effects of this vaccine on those different populations, because there might be groups of people who you determine cannot and should not get this vaccine.
Wow. Okay. It's been a while, and I think we'll probably want to hop on again at another stage with Pastor Jenks. So I think we can close it now. Prof. Wilmore Webley, there's a little line that you'd say about virus. Waiting for the harvest. Pastor Jenks is coming. He's just letting us know that they're singing their closing song. But would you like to share that little line that you use about the virus just wanting to make more of himself?
Yeah, I mean, so that's the goal of a virus, right? A virus and any microbe at all, they're looking for a good host, right? Viruses cannot replicate on their own. Most bacteria, unless they're obligate intracellular, can actually replicate in a medium. You can put them in a broth and they'll grow. You know, that's why if you have something and it gets contaminated with bacteria, you see it become cloudy. Viruses cannot do that. Viruses need a host cell in order to live. So essentially, the virus never intends to kill you, none of them. Whether it's HIV or your coronavirus or hepatitis B, all they want is to make more of themselves. Unfortunately, sometimes in the process of them making more of themselves, because they're so aggressive in utilizing all the resources, and sometimes they actually burst out of a cell instead of budding out, they end up killing the host. But in microbiology, we like to say that a successful pathogen never kills its host. Because if you kill the host, you have to find another host to get into really quickly. Otherwise, it wipes out the virus. And that's why initially Ebola would just burn itself out, right? If you remember the 1970s, 1980s, even 1990s Ebola outbreaks, they killed a handful of people, only the people who had them, their family members, or the healthcare workers who took care of them. Why? Because it was so aggressive. It had 90-something% mortality. So nobody was going to transmit it. It caused such damage in the host that the host became immobile. They weren't going anywhere. They were too sick to go anywhere. They started hemorrhaging. Nobody wanted to be around them, and it killed the host. So it doesn't get transmitted. Now the 2014, 2015 Ebola outbreak, what it did is that it found a way to keep its host alive for longer. And in that way, it was able to transmit better. So this virus does not intend to kill us. All it wants is to make as much of itself as it possibly can. And when it's done that, to get to another host so that it can make more of itself and to stay around for as long as it possibly can. So that's its mindset. Of course, if you're infected with this virus, you don't care what the virus wants. All you want is to be out of your system. You don't want it inside of you. I think it's my friend sometimes that there's a show called Family Matters in the US with this guy, Steve Urkel. And you know, he's kind of a little wacky. And his favorite line is, did I do that? Bump something over. You know, he would bump into something. He would knock stuff over and he's like, did I do that? And that's kind of how I see this virus. When it kills a host, it's like, uh-oh, did I do that? You know, because it doesn't intend to. All it wants is to make more of itself. It just wants to keep going. So it accidentally, and there's zoonotic, right? We're not its primary host. Its reservoir is a bat. The bat doesn't have any symptoms from it. And so when it gets into us, that zoonosis, that accidental host, is much more susceptible many times to dying from the virus. And the virus has to find a way to modulate itself so it's not as aggressive.
Thank you so much, Prof. Pastor Jenks. Unmute yourself, please.
All right, so I want to thank my good friend, Dr. Webley, for sharing these things with us. And friends, as he said, the one thing that he said, if you didn't get anything else from what he said, it's one thing that he said, please take this serious. This is not something to play with. And you know, in case somebody might be wondering, man, this sounds hopeless or anything, no, Dr. Webley is not a message of doom. I heard a lot of hope in what he was saying, and that is we just have to do our part. And if we do our part, then the likelihood, or we have a better chance of really helping ourselves out. And so please do not see this as something that man, I can't do this. No, you still have a life to live, but just do your part. You still have to go to work, some of you. You still have to go around shopping. You have to do that where other people are. Listen, please do not go into your house, lock yourself up like a hermit or whatever the case, and say, Dr. Webley said this virus is so serious that we can't do anything. No, he's not saying that. He's just giving us the facts so that we could better prepare ourselves for this. And I'm not going to keep you any longer than what you have been on here for. I've been asked to share my testimony. I will only be about 5 minutes, if that's okay with everybody. All right. So back in March, my wife. So my wife came. My wife has asthma, and Dr. Webley was talking about that. And so she came to me and she said that she was having a hard time breathing. All the symptoms, doctor, that we talked about here of one having the virus, she had the aches, the pains, everything. Now they tell us that if somebody in your family has it, quarantine yourself. But I didn't do that. I felt so bad. I would crawl up underneath her, hold her, and knowing that there was a good chance that I might get it. And the telltale signs were there. My throat was starting to get scratchy. I was starting to have all these headaches, but I said, well, you know, it's just a cold. I'll get over it, because I don't really get sick like that. So I thank God for having preserved me for these years. And so my wife, who's a nurse, because of the virus, they had to they closed down the operating room, and they were only doing surgeries only for serious, complications. But as far as the nurses, they sent them home. She didn't ask for it. They gave her 2 weeks off, the 14 days. During that time, she got better. She was well, she was excited, but guess who was getting sick after she got better? I was. And so she says to me, you have the virus. I'm like, man, get out of here. I'm a guy. I'm not admitting to anything. And so I said, nope, I don't have the virus, nothing. And then I woke up one morning feeling really bad. And I'm just that type of person. I don't know why. And I'm learning how to depend on people a lot more. And I should have called my elders and said, listen, guys, I really don't feel well. I can't speak that today. But I didn't do it in my head. And maybe this is pride. I'm going to do it. I got a message. I believe they need to hear it. I'm going to give it. Man, 5 minutes into the sermon, I could not even breathe. And I'm struggling. I think I preached for about 5-10 minutes. And then I prayed. And as soon as I prayed, I hung up the phone and I came back upstairs. I'm huffing because I was out of breath, and I just laid there in the bed. And then I got a call from my first elder. He said, but brother, I could tell something was wrong with you. And that's when I said to him, I think I got the virus. And so I went to the hospital. Instead of doing the nose swab like they normally do, and by the way, again, I'm on my way there. I was like, oh Lord, don't let them put that stuff down my nose, because I've heard so many stories about it. So I'm like, oh, please don't let them do this. And so I went to the clinic, and when I got there, I told her what my symptoms was. She says, you know what? Before I do the nose swab, what I will do is we'll go and X-ray your chest. Gave me an X-ray, came back out. and I should have known something was up because she wanted to come into the door. It's almost like she gave me the news right in between the cracks of the door without fully coming inside the room. So I'm like, man, I know something's up. And finally she says, you know what? You have pneumonia, and it's the kind that we see in the coronavirus. And then she said, do me a favor, go home. And she said, do not quarantine yourself. She says, don't go anywhere. Go get these meds. But after you get the meds, go home. If you have to go back out, wear a face mask, but don't do anything. My friends, before this, my wife would tell me to go out, wear a face mask. I'd be like, no, I'm not wearing no face mask. No, I'm cool. I'm all right. God will take care of me. I'm cool. After coronavirus, not only was I wearing one face mask, I was wearing 2 face masks. And my attitude was, listen, I don't know you. I love you. I will help you. But man, don't come this close to my face. Stay well. You can still talk. But the point that I'm trying to make, friends, is that I was doing whatever I can to protect myself, to protect my family. Because when I got home, some people here in the United States, they have what is called a finished basement. So they can live in their basements. So when they find out that they have the virus, what they will do is they will move down into the basement because they have all the living quarters there. I don't have that privilege. So the minute I came home, I told my wife what she had. Man, now remember I told you that I was comforting her, putting my arms around. Man, homegirl cleaned up our room so fast and went to another room. I spent literally 1 month without sleeping with my wife and having to hug and hold my children. Now, I didn't want to have to do that, but I needed to do that because I had them to think about, and I didn't want to infect them again. So they gave me the antibiotics. I took the antibiotics. After a week time, I was feeling a lot better. Dr. Webley is here, and I would call him up, and he would share some insights with me. I've never had, pneumonia before, but Dr. Webley, he told me that, and he would always assure me I'm going to be okay. Sometimes I thought I was dying. Sometimes I thought the jig was up. I was having a hard time sleeping. I was up at night. I couldn't hear. I stopped watching the news altogether because it was so negative. And so I didn't want that to affect my brain. A friend of mine who died of the virus, at 1 o'clock in the morning, he ended up passing away. And guess what? I thought at 1 o'clock in the morning, same thing was gonna happen to me because I was feeling so bad. So I had to literally cut out all the negativity and all the stuff and keep telling myself, by his stripes, I am healed. Every single time I was feeling down, I would just claim the word of God. I will restore your health unto you. I will not put these diseases upon you. And then the one thing that helped me out the most, and I don't know if Dr. Webley knows this, but he says to me, the issue is not whether or not if you will get the virus. Because no matter how healthy you are, in some sense, this virus, for some reason, it seems to have figured out if you come up with a way to attack it, it'll come up with a way to attack what you came up with in order to attack it. And so Elder Webley said, if you have a strong immune system. So what I started doing, and at that time, by the way, underlying conditions, I had severe, and Elder Webley, I never shared this with anybody, but I had severe digestive issues. I was overweight. I weighed, and I don't know what the link is in Cape Town. I weighed 225 pounds. Being a 5'8" male, my BMI, my body mass index was, I think it was, I don't know if I'm saying it the correct way, but it was about 30%. And if you look at the chart, it would say obese. I used to think that you had to be like super big in order to be obese, but that's not the case at all. I was out of shape. I mean, all these things. So when I got sick, to be honest with you, friends, I hate to even say this, but in some sense, it happened to me because I wasn't really taking care of myself. My wife, she will tell you, thank God for the coronavirus. Because what the coronavirus did, it made me take serious awareness of my health. As Elder, Dr. Webley, please, Doc, forgive me, man. I'm so used to calling you Elder. I'm so used to calling you. As Elder Webley said to me, or said to you guys as well, he said, guys, just make sure that if that you are following a nutritional diet, or you're doing all that you can in order to keep yourself healthy. So what I started doing is I started practicing a healthy lifestyle, exercising every day. I started being careful what I ate, spending more time outside in my yard where the sun is, practicing breathing. I mean, just because of that, I lost over 30 pounds. I am now 100. This morning I checked, I was 188.2. I'm still overweight by my body mass index, but friends, I'm determined. If we have a second wave, at least my immune system will not be as weak as it was before when I contracted. I'm here today because God is so good. He is amazing. And I know that if he can do that for me, he will do it for you. Somebody asked, is there any, what do you call those, any herbs or anything of that nature? Can those things help? It may, listen, anything can help. It may not stop you from getting the virus. You want to know your only safety against the virus? It's God himself. He's the only one that can keep us from having the virus. So please, let us be careful out there. Take care of yourself, and I believe that you will be blessed. God bless you.
Amen.
Amen. Thank you so much, Pastor James, for sharing your testimony with us. And we're very grateful that you are here today. We thank God for that. So
down a little bit because he was truly sick. I mean, he was so sick. I was very concerned about him. And he was a warrior. He pushed himself through it mentally and physically. There were times when I got on the phone with him and he lost breath. He wasn't able to talk with me to continue the conversation. He would just lose the ability to speak, and he would have to get off and just, lay. And so God truly has brought him out and given him a testimony.
Go ahead.
He made it simple, but it wasn't. He really had a hard time getting through this.
And so after a week, I was feeling much better with the antibiotic. But something that I've learned, again, Dr. Webley, he's my personal doctor. So he's the one that I go to, him and my wife. So one of the things that I've learned is that when you have pneumonia attacks, obviously fluids begin to fill your lungs. But your body is designed in such a way that it begins to literally fight off, or at least try to fight off all those infections. So even though you might start feeling better, but remember all the mucus and all that stuff that your body uses to try to fight off those infections, guess where those things go? They go right in your lungs. So in a week time, you might be feeling better, but it literally takes at least 4 to 6 months for your body to fully recover. And everybody that I spoke with who had pneumonia said it almost took them out. It took them a long time in order to recover. But what made this so terrible for me is that usually when you have pneumonia, it'll attack one area, and I think Dr. Webley alluded to this earlier. It'll usually attack one area of your lung, but with the coronavirus, I mean, I was seeing spots when they showed me the X-ray. I was seeing spots everywhere. And even when I went back, I had to do a physical. My entire body was in function in order to try to fight off whatever inflammation, whatever stuff due to the gastrointestinal how do you say that? The gas,
Intestinal.
yeah, there you go. All the inflammation. When I went to the hospital to do a physical, they said, man, my lungs were okay, everything was okay. But then when she looked at my kidneys, she said it was slightly dehydrated. And she said, you need to drink a lot of water. Go now, start drinking water. And the only reason why I bring this up, friend, is that if you've had the virus and you're now recovering and you see some symptoms coming back up, please don't give up hope. Just know that you have somebody who loves you so much, and that he is on your side. He will that just keep claiming the precious promises, and just know that you are not alone.
Thank you so much, Pastor Jenks. Thank you, Professor Wilmore. Thank you to all the panelists. Pastor Jenks, we ask you to pray now, a special prayer for our people that are listening in, our family members and the friends of that tested positive, and for those that are also has lost family members and that are in their grieving. And we want to ask you for a special prayer for them right now.
All right, let's bow our heads. Father, we thank you so much. Truly, indeed, you are never unaware of what we are dealing with. And Father, what is so amazing about you is that you are not a father that is so afar off that you do not know what we, your children, are faced with. And Father, no, there are some who would accuse you of being the one who have sent this this virus. But Father, we know that the virus did not come from you. And for whatever reason it was allowed, it is being allowed. You are there with us every step of the way. And when we think that you are not able to be touched with with our infirmities, your word tells us that in their affliction, you too were afflicted. In other words, Father, whatever we're dealing with right now, you are dealing with the same thing too. All the pain, the suffering, Father, you are suffering just as much we are suffering. It's not just us who are suffering, you're suffering because you identify with the human race. Every pain that is felt in the very depths of our being is also felt in the very depths of your being. And so, Father, we pray that those who have been afflicted by this and those who are going, that you will draw so ever close to them, letting them know that you are there right by their side, that you understand what it is that they're going through. Those who have lost family members, Father, I pray that you would be their everlasting strength, be their comfort, especially in these times. And Father, we know and believe that one day Jesus will soon come. And when he does come, all the pain and suffering and sickness and illness that we had to go through down here, we know that they will be no more. For when that day comes, there will be no more death, neither sorrow, no tears, for we know that the former things will be passed away. So, Father, we thank you for your precious promises, which says he was wounded for our transgressions, and that by his stripes we are healed. You made a promise to us over in Jeremiah where your word tells us that you would restore our health to us. So, Father, glorify your name by restoring the health of those who have been crying out to you day and night, those who have suffered so much pain. By your grace, we ask that you would restore their health to them again. And so, Father, we thank you. Thank you for all those who are on this panel. Thank you for the work that they do. And thank you so much, Father, for the wisdom that you have given to them. Some who have put themselves on the line, who puts themselves on the line each and every single day. Even some who are listening to us, who have to be out there day after day, sacrificing even their own lives. And yet, Father, they never think twice about doing it again. Father, please be their shield, protect them, watch over them. May you bless them and their families. We ask this in Jesus' name. Amen.
Amen.